I'm here representing TACTS, the Association of Clinical Trial Services. And today I am sitting in for Sister Yah Simpson, and we'll be talking about health equities equals black unity. And what I'm talking about right now is not just one aspect of health, but the whole total health. When we talk about nutrition, we're talking about disease, as well as substance abuse. That's my specialty. I am a substance abuse counselor by trade, and I have been working with this particular population for over 25 years. And we know that right now, according to the local media, we are dealing with what we consider a heroin epidemic. And we know that for a lot of people, substance use has been a scourge in their families, on the neighborhoods, on the communities, and we know that it costs society trillions of dollars. If you haven't heard the latest report, they had a caption out, I think it was on one of the news segments, that talked about when need meets greed. Basically what's happening is we got a lot of people that need substance abuse treatment as part of the health equity paradigm. And right now we got a lot of people who are charging exorbitant amounts of money to provide a basic need for people to get in treatment. So what I want to discuss today is how we can look at some of the strategies around helping people to access the necessary care that they need so that we can develop a paradigm for health equity and keep people safe and healthy. Let me talk a little bit about some of the best practices. We know that over the last decade or so, treatment has taken a major shift. We know that with some of the bureaucrats and the bureaucracy that we are suffering from, particularly here in Illinois, that the funding for these services has been drastically cut and or eliminated. So what we need to do as a community is to start talking about how we can intervene with our families, how we can start to talk with our young people, how we can talk to our friends and colleagues about providing some treatments that will be effective for the household, for the community. We have programs that will provide services for minimal cost, but of course we have to get everybody involved. It's not just a one-dimensional situation. We need to have family members. We need to have the children. We need to have grandparents. And everybody has to take an active role if we're going to make a difference in staying healthy, particularly with substance abuse. We know that there are some policies that's been put in place that hasn't really, been favorable to a certain group of people. Particularly people of color, who we know suffer from most social ills at what we consider disproportionate rates. So we need to really work on getting our families involved. Let's get educated. Let's get information. Let's get active so that we can start to change some of the policies. If you have legislators and if you don't know who your aldermen are, if you don't know who your state reps are, then we need to start talking to those people who's supposed to represent our best interests. And let's start to generate the revenues necessary, or at least generate the voice necessary to effect some change. Because if we don't push for these particular services, then we won't get them. Like I say, I've been doing this for over 25 years, and I've seen where we done went from a 6-month program or a 12-month program down to a 3-month program, down to a 30-day program. And now we got what we consider this Affordable Care Act, which is, for all intents and purposes, is a good thing. But unfortunately we have some parts of that that will not allow for people to access services the way they need them. So it's imperative that we as a community step up. What I mean by these particular factions that's not allowing us to access services, and I don't want to be too crass, but we know that insurance it's a good thing to have for a lot of people. But it's not so good when you can't get the necessary treatment that you need without having to go through a bunch of what can I say, bureaucracy, a lot of changes, and of course then they limit the amount of care you can get. It's not based on what your assessment dictates. It's based on what they're willing to pay for. And now it's more about finances than it is about people. So we need to make a push to try to change that. I am personally working with a group now so that we can start to advocate to get a single payer system. That we can start to eliminate some of the hoops that we have to jump through to get people in treatment. Like I said, I've been doing this for a while, and the last few years has been a nightmare. And we know that, like I say, people of color are not getting access the way that they should, or way other ethnic groups are getting access. And a lot of times it's primarily based on the fact that we are not given the privilege to talk to the doctors the way we need to. We're not given the opportunity to go in and get the necessary tests that we need to, because the fact that the companies say that we don't meet the need. And so we have to start to make sure that we let people know that we do need it and we do want it and push for it. It's unfortunate that I have lost a lot of my colleagues and peers over the last few months due to this so-called scourge of addiction, due to a lack of access to health care. Unfortunately, I went to 3 funerals in 1 month. But I'll be right back.
So with TACTS comes a cure, and we did talk about health equities, and I'm Sister Yad. Is this okay? It's not going over any further. So with health equities, we talk about people being more on point with how we get our health. I'm Sister Yad, and I'm just getting to this point with you all. You heard Charles Patton, and we're with TACTS, the Association of Clinical Trial Services. And one of the things we think about with health equity is, why does it matter? I mean, what really is health equity? And it's not being equally sick. That's the one thing we want you to know. Health equity means that you get what you need for your best health. So we don't want people to think that we're at the point of being equally sick. What we're thinking is that we're at the point of being as good health as possible. So this is the part where we talk about, you can call in if you don't understand what health equity is at 312-738-1060. But if you understand the concept of health equity, then you understand that you have to be able to bring something to the table. And we talk about that in the idea of that the community brings something to the table. Everybody has something they can offer. So when we look at this triad, we know that we have policy change. We know that we have, which is the legislation, right at the top. We have what we call institutions. We know those, universities and businesses. But the part that I want you to focus on is the capacity for the community building. And that's that third piece at the bottom. I hope you saw that. We want you to know that having the community involved is where we really think that we can work on our health equity. I understand that some people don't get that, but what health equity is not, it is not stigma. It is not, as far as we know, prejudice. That's not the point. It is not racism, xenophobic, or hate. So these are the things that health equity is not, but we want to work on what it is. It is trying to make sure that people get the best health possible. So what has happened? I was able to attend the Illinois Department of Public Health Association's 75th conference just last week. And it was a wonderful conference. It was their annual conference, and it was about public health. And the one thing that we definitely focused on is looking at the cutting edge of assuring what? Equity and brokering investments in population health. So everybody's talking about health equity. I was there with Reverend Green, and we got to work on the Men and Women's Prison Ministry assessment tool, their needs assessment tool. That was wonderful, well received. I also was able to work on another project with the Chicago Department of Public Health, and then we worked on the medical monitoring project that was well received. In fact, it was extremely successful. So these were some of the things that I was able to do, and I'm talking, even though we're saying medical and monitoring, we're saying needs assessment. This is around the concept of health equity. This is how we're going to push what the community should be doing. And some of the things that we worked on is Dr. Jones was able to come in. Now, she is the president, Kamira Phyllis Jones. She is the president, MD, MPH, PhD. Have you seen that, an MD and a PhD? This is Dr. Kamira Jones. And she is the president of the American Public Health Association. Along with me, I was there with Reverend Green, the community for Men and Women's Prison Ministry, and of course, you know me, Yah Simpson, your community epidemiologist with TACTS, the Association of Clinical Trial Services. Again, I'm trying to get you all to, and this what Charles was talking about earlier, is health equity. Call it 312-738-1060. And one of the things that I loved about Dr. Jones is she focused on the concept of health outcomes, and the health outcomes and what's impacted by that outcome, racism. Her whole platform was about how if we don't fight racism, how it will not allow us to have the best health possible. And what we have to do is everybody has to fight racism, not just blacks, not just Puerto Ricans, not just people who are undeserved or unserved or misguiled. We use words like proletariat. Not just that, everybody, even if you've been diagnosed with affluenza, call in for that one. You can participate in how to address health equities. And Dr. Jones, who is the Dr. President of the American Public Health Association, her whole platform for APHA will now be, how do we combat racism? The reason I brought that up is because she was also at that IPHA conference, and we were able to give a lot of credence to that. This is one of the awards that I received for having one of the best posters in the data section for medical monitoring project, and I was very happy to receive that. It was I didn't even think I was gonna get it. And then here is John Aquabuch. He is with CDC as the Associate Director for Policy and he was at the IPH conference and along with me and the IPHA president. So what we worked on, what our whole focus has been around, was how are we going to help our community to be able to bring in more concepts around health equity. So there's a couple of things I want you to do. First of all, I remember I talked to you about APHA. I want you to Google them and look up their platform, because the president, Dr. Jones, is going to be moving into the concepts of how we fight racism within healthcare. Health is important, and more impacts on health that we have, the worse our health is. So we have to work around racism. And I also want you to go to cdc.gov, obviously, and you can look up some of the steps that they're calling it. They call it winning. The winning fields, the winning concepts that are working, the benchmarks that they have made, and what has been getting strides. they were able to show us, and he was able to demonstrate to us that they are actually working with insurance companies now, which I thought was interesting, and they're trying to impact their bottom line. For me, what that means is that we need to come up with, when an insurance company is saving money because they don't have to put money into someone being sick, where does that money go? Well, what we do know is that if they did more on the prevention side, they would have less to pay for on the treatment side. And what we know is that value-based concepts work. This is what we mean by value-based. We mean that there is an actual value to having a prevention specialist. There's an actual value into having a community health worker in your organizations, if you will. These individual these particular job specifications allow for people to prevent before they have to treat. And if they have to treat, adherence to treatment and or getting care. So these are the topics that I am working with around the health equity initiative. I'm with several organizations that I like to mention, including the National Black Association Consortium, where we are looking at a national agenda. We've created a national agenda for blacks and their outcomes. And one of the pieces that I took on, besides the women's piece and the health piece, was the veterans piece. Hey, we have a caller. Thank you for calling in live. Can I help you? This is Sister Ya.
Good evening. Hope you're having a good day. How can we really change it when it's so institutionalized? It's built into a system where, how you want to put it, where people that got a light pigmentation, they get all that matters. They don't have to go through certain changes where people of color, they got to jump through all these hoops and stuff just to get a Band-Aid and an aspirin.
Yes, sir. You are absolutely, your assessment is well heard and has been expressed widely. So let me just be clear. Just because someone ain't listening to your song don't mean you stop singing. If you need better health, then you get with groups like mine and others who advocate on your behalf. You are quite correct. This is a systematic issue. In fact, one of my, I can call him an elder, his name is Baba Olamenje, and he talks a lot about systems organization redirection. We are in a systems environment where many systems are running at the same time, but guess what? The anathema of those systems is that it's for white privilege, or I call it white complex. So caller, you have a point, and I understand it, I receive it, but guess what TACTS does? TACTS fights back. We don't give up just because it's too hard to fight. We maintain and we keep pushing. And one of the things we're pushing for is making sure that we have health equity at our fingertips. Did that help, caller? I hope so. One of the things that I really wanted to drive home was when we say health equity, I don't know if you can see it, but the equity depends on what it is that you need, so that we cannot be equally sick, but as best health as possible. That is not equality. It is equity. So caller, we have to ask for what it is that we want. If we want something better, then we be that change to see it get done better. I am going to also be in October. I'll be at the Museum of Science and Industry, and we will be talking about healthcare topics. I'm one of the few epidemiologists, community epidemiologists, that is on site that can talk about public health in a grand fashion as far as when it comes to careers and jobs, and what those careers and jobs and how to obtain those careers and jobs process can be. The caller made an excellent point, but I keep singing my song, and you can tell my hue is not lightly, okay, or brightly, but it's distinctly dark to have the mark of divinity. So I want to thank you all for looking into this. I want to make sure that we keep discussing the concepts of health equity. I would like to give you a small update that the new hepatitis fact sheets just came out from one of the bigger health organizations. Next month, I hope to have those out for you, or at least we can discuss it. Again, thank you for watching this particular show on CAN TV, and you can see us online live, okay? So go to CAN TV hotline, look for it online live. You don't even have to have cable TV to watch this. But thank you so much. And again, my name is Sister Ya. I want to thank my co-host, Mr. Charles Patton, and we are with TACTS, the Association of Clinical Trial Services. Thank you.